So MSN, RN, is a master's prepared registered nurse with certifications in both critical care and gerontology. She brings 32 years of diverse clinical experience across some of the most complex areas of patient care. Leslie's nursing career began in oncology, where she cared for patients undergoing bone marrow transplantation and chemotherapy. This early work established her strong foundation in precision, high acuity care, and compassionate support for patients and families navigating challenging diagnoses. She later transitioned into intensive care, dedicating much of her career to caring for patients recovering from cardiac surgery, as well as those facing serious infections and other life threatening conditions. Leslie has extensive experience in recognizing and treating sepsis and septic shock, drawing on many years at the bedside supporting both patients and their families through critical moments. Today, Leslie serves as a clinical nurse specialist at MedStar Southern Maryland Hospital, where she provides expert clinical guidance, staff education, and leadership aimed at improving patient outcomes. She is especially committed to advancing early recognition of serious illnesses, including sepsis. Leslie is deeply passionate about community education and believes strongly in empowering individuals with the knowledge to recognize early warning signs of infection and to know when to seek urgent medical care. Her mission is to translate complex medical information into clear, practical insights that help keep her community safe and healthy. And at this time, we are going to turn it over to Leslie Johnson as she proceeds to inform us and enlighten us on matters of sepsis. Leslie?
Thank you so much, everyone, for joining this conversation. Sepsis has been a real passion of mine, and trying to communicate and educate the community as to the early warning signs, how you can identify it, get prompt treatment, because I think knowledge is really key and powerful. And just so hopefully you will walk away from this presentation with feeling like Leslie has educated me on these early things to identify within myself or my loved ones or family or friends, and so that we can get that prompt treatment, because it's that prompt treatment that's going to assist us with improving our outcomes for sepsis. Okay, so what is sepsis? So sepsis, by definition, it's a life-threatening condition that can be caused by various bacteria, viruses, or fungi, or even parasites. For individuals that may travel to other countries, this is a real potential outcome that they could experience in the development of sepsis. Unfortunately, sepsis is one of those leading causes of death in hospitals. I know we hear a lot about cardiovascular disease, but in terms of people presenting with sepsis, which is usually that late presentation that they present with, and we'll go more into discussion about that, it outbeats individuals who may present to the hospital with prostate or even breast cancer or even drug overdoses. And unfortunately, many individuals are reporting at the later signs of sepsis because of unawareness. And so that can contribute to a decreased life expectancy and poor outcomes from the development of sepsis. We know that there are social disparities that also contribute to our individuals who may develop sepsis or even progress into later sepsis. So our non-white populations, our Black population, our Hispanic populations, they are at a greater risk of late presentation and death, and if they survive, having severe complications that could be life-changing that they may have to live with from the development of sepsis. So sepsis in itself, without that that early recognition and the initiation of prompt treatment, can progress into septic shock. And that septic shock can look like a collapse of one's system. So they may have some organ failure that may develop, which can also lead into worser outcomes for individuals experiencing shock. It is that vigilance and the importance of that early recognition of signs and symptoms and diagnosis that that we're hoping will improve the outcomes of sepsis and that early prompt treatment so that we can decrease our disparity and deaths that are experienced within our community. At Southern Maryland MedStar and MedStar system as a whole, we like to encourage and teach our community an acronym. And we took sepsis and we broke it down and defined what are some of the early signs and symptoms that you may recognize in your loved ones, in your family or friends, or yourself. So just going through the acronym, the first S stands for shivering. So you may feel, or your loved one may complain of feeling feverish. So you see them with that active shivering that's going on. Or if you just touch them and you're like, wow, you feel really cold to touch. That's a sign of sepsis. E stands for extreme pain or discomfort. Now, this pain could be something that's localized, like if you have a cut or an infectious process going on somewhere within the body, that pain may be localized, or it could be just general pain that you're feeling throughout your body as that sepsis is moving from sepsis into shock state. P stands for pale or that discolored look that they may experience. So with our white population, you may notice that they have a gray color to themselves, or they may experience what's called mottling, which is kind of like a bluish tinge you may see in their lips, in their fingernail beds. In our darker population, they may just have kind of an off color about themselves. I recently experienced a family member who was heading towards sepsis. And as I was looking at them, I was like, wow. And he's a very dark-skinned individual. I said, your color just looks off. The lips were very pale looking. He had a dark hue to himself, which a lot of people may not initially think is possible sepsis, but that's where we were headed. These individuals also may be very clammy or sweaty because they're experiencing fever that is a natural response to trying to cool the body down, where they get very clammy and sweaty skin. The next S stands for sleepiness. So all of a sudden you're tired, or your loved one is very tired and they just want to sleep. New onset confusion, which is a high one that's experienced by our older adult population, which could be a first sign of an infection that may be developing. They're just not themselves. They're confused about how to do simple tasks, or they just seem disoriented. I feels like that in what we in the healthcare system call impending doom. When that patient or loved one tells you, I just feel off, I feel like I might die, that's an important sign to listen to. And the last S stands for shortness of breath. So all of a sudden, I just can't breathe as well as I used to. I get very winded when I'm doing simple tasks or even just sitting. They just feel like they can't get breath in, they can't get breath out. These are all signs and symptoms of infection, of sepsis. So signs and symptoms and that early recognition is key. So if you're noticing these early signs and symptoms, such as shivering, cold to touch, pain, they have that off color look to themselves, those are signs that you want to act on. They may seem benign, like, oh, they just have a little, maybe they're just fighting a little cold or infection, but those are the signs that's when we want to act, because you're going to have better outcomes with treatment and survivability. When we start moving into that feeling of doom, that breathlessness, we're worried that the patient may be heading towards septic shock, which is that shutdown of the body systems. So we want to act on these early warning signs that could be presenting to us. The signs of sepsis moving towards shock, which is the later signs and symptoms that I talked about, they may have low blood pressure, dizziness upon standing, or even just sitting. Decreased need to want to take in fluids, which then results in a decreased urine output. So they're not utilizing the bathroom as often. They're holding on to fluids. So you're noticing that they're getting swelling in their lower extremities or in their arms. That's the body system starting to shut down. And that mottled skin, and sometimes individuals develop rashes out of just nowhere, it seems, like a red rash that may appear all over the body. Those are those later signs and symptoms of sepsis. So it's crucial that we teach the community those early recognitions of sepsis are acted upon. Oh, excuse me, let me get rid of that. Those early recognition signs and symptoms of sepsis has a better chance of survivability and better outcomes. So it's crucial that when you recognize these things, we act upon them. So what are some causes of sepsis? As I mentioned earlier, bacterial infections. So we are in cold and flu season. So we are seeing a lot of individuals presenting with pneumonia, urinary tract infections. That seems like a very benign one, but our aging adult population, sometimes they're just not taking in enough fluids. And I know every time I go visit my 99-year-old grandmother, the first thing I'm saying, Granny, have you drank water? Because that thirst sensation starts to diminish. And so that puts them at a greater risk for developing urinary tract infections. You may have a simple cut or surgical site infection. So let's say you had a recent surgery. All of these things are sources for bacteria to enter and cause an infection. Fungal and parasitic causes. So yeast infections, parasite infections. So speaking of fungal infections, I'm just going to use the example, if you may use inhalers to treat your lung disease that you may be experiencing, you're always encouraged to rinse your mouth after you use your inhaler. Why? Because that medication sits on the tongue and it suppresses our natural bacteria and organisms in our mouth to help keep our mouth clean, put you at a greater risk for developing fungal infections in your mouth. So um, we want to be mindful that we're looking out for these particular sources of infection. If you travel overseas, or if you just turned on the news like I did this morning just to catch my little 15-minute blip, because that's all I can handle these days, you'll see that we have an increase in measles. So being mindful that these potential sources of infection are out there, and these are risks for us to develop sepsis. Severe or untreated infections, individuals with weakened immune systems, these are all a risk for putting us at a risk for developing sepsis. Okay, so kind of spoke on this already, but I'm just going to go a little bit into more detail. So individuals with chronic infections. So we know diabetes, cancer, these things weaken one's immune system. So this puts you at a greater risk for infection development and the risk of developing sepsis from something that could have been a very benign, simple infection. It can increase into something that's far greater. Individuals that have a compromised immune system. So individuals that may be experiencing cancer treatments, or they've had cancer treatments in the past, or maybe you have an immune suppressive disorder. Maybe you're on immunotherapy medications. All of those things can put your body system at a weakened state so that what was a simple infection can blossom into something that's put your life at risk. Age and pregnancy factors. So, of course, our infants, their immune systems are very weak, newly developed. And in our elderly population, our immune systems are kind of drawing down as we age. So, this puts you at a greater risk of and physiological vulnerability for developing sepsis. And then lifestyle environmental risk. So, we know these social determinants of health decrease resources for healthcare information, lack of ability to obtain healthcare. These things put you at a greater risk for the development of sepsis. And then we also have to remember we have to talk about those lifestyle behaviors that are out there that are a risk for individuals. Individuals that may engage in high risk sexual activity that can put you at a greater risk for developing sepsis. And then, unfortunately, IV drug usage. That is a direct line to infection. So, these lifestyle changes, environmental risk factors, definitely put you in a higher category for the development of sepsis. So, what can we do to detect, to prevent sepsis and decrease our sepsis response? Early detection and emergency response. So that early detection of the early signs of symptoms of sepsis with our acronym. Um, if you notice these signs and symptoms in yourself or your loved one, getting that prompt early intervention is going to be the best course of treatment and outcome for you. Emergency medical response. So we don't want to wait on this. If the person is deteriorating before you, you want to call 911 because that's going to escalate that treatment and get them sooner into the proper environment where it can be recognized and acted upon quickly. Public awareness. So forums such as this, where we're educating the public about those early signs and symptoms of sepsis and acting upon it so that you can get prompt and early treatment and interventions. So this will improve our survival outcomes and prevent mortality. So prevention strategies. We know that the very first way to prevent infections is through hand washing. It can't be understated. Proper, thorough hand washing is the number one way to help prevent the spread of infections, especially in our cold and flu season. So I always like to demonstrate how do we do proper hand washing. So if you have jewelry that's in place, you need to remove that because bacteria hides in these places. So you're going to remove your jewelry. You're going to get your soap and water. You're going to lather up, and then you're going to choose a song of your liking. Two of the popular ones is the happy birthday song. So you're going to sing happy birthday, or you can go through the ABCs. And I think this is a great way where we can even teach our younger generation, our children, our grandchildren, our nieces, nephews, how do we properly wash our hands and make it fun. And so you want to lather up, wash your hands really well, sing those tunes. That's going to equate to about 20 good seconds, and be vigorous with it, not just a light washing, very vigorous so that you're lathering up. You sing your ABC song or your happy birthday song, and then you're going to rinse your hands. And then the next thing you're going to do, don't touch your faucet. If you have a paper towel, maybe use a faucet to turn that faucet off. Or if you're like me, a healthcare individual, I'm just always used to using my elbow for everything. It's really important that we engage in good hand hygiene before our meals, after our meals, and especially exposure in public spaces. So if you like to go out, let's say you go to the gym, you go to social activities at your community center or your churches, it's always crucial that you wash your hands after those public exposure places. Routine vaccinations. So in our aging population, we want to make sure that we're getting those boosters that were required and even getting those vaccinations that may be required as we move into our older years. So our pneumonia vaccine is one that comes to mind, and you can check the CDC website. I know there's been a lot of changes there with recommendations, but I would encourage you to follow up with your primary physician to just kind of review what vaccinations do you think are appropriate for me at this age, to make sure I'm decreasing my risk for developing infections. And then our children. So we want to encourage our children to make sure that their children are receiving their vaccinations on schedule. Once again, I would consult our CDC website, and then encourage your children to reach out to their pediatricians to make sure that their children are not at risk and with having gaps in their immunizations, so that they're not at risk of developing infections that can then be passed on towards you. Um, Proper wound care. So the picture here displays a patient that may have had just a simple little nick in their skin, but that simple nick is an entry source for bacteria and funguses and viruses to enter and then spread into something more systemic, which is sepsis or septic shock. So making sure that we're keeping our wounds cleaned, we're keeping them covered, and that you're even just doing checks of your skin, especially if you have chronic conditions like diabetes. So we know that individuals that have diabetes may have decreased sensations in their feet. So you want to make sure you're checking your feet, you're checking your legs, your hands, making sure you don't have any open sources. And if you do, you're treating them with soap and water, and you're covering them. If those cuts or wounds seem to be not responding to those simple treatments, you need to escalate to your primary physician, because it could be something that's may warrant medical attention to fix. Chronic conditions, I kind of spoke on the diabetes, heart disease, lung disease. So these conditions lower one's having a mental blank. It lowers one's ability to fight off infections. So you want to make sure that you are staying on top of managing your chronic conditions, making sure you're keeping your blood sugars within control and that you're monitoring them, doing your skin checks, as I mentioned, making sure that you're following your medical regimens that have been initiated by your medical team for managing your heart disease, your lung disease, and then just making sure you're staying on top of your routine medical visits to make sure that you're in good health standing. If you should develop sepsis, recovery is a whole nother phase. I think in the healthcare system, we really just focus for quite some time on just the identification of sepsis and the treating of sepsis. But what has come out in the literature and the research is that there is a phase of recovery of sepsis that has been really kind of undervalued. So individuals that develop sepsis and then and they survive that sepsis or that septic shock, and they are sent home, they can experience a numerous amount of difficulties afterwards. So recovery can differ widely amongst individuals, depending on what your age is, your health status, and your health history can affect how quickly or how slowly you recover from sepsis. Post-sepsis syndrome symptoms. So symptoms that individuals who have been interviewed who've developed and survived sepsis that they've discussed are symptoms of extreme fatigue afterwards, emotional vulnerabilities, cognitive issues, so such as fatigue, anxiety, memory problems, muscle weakness. Some people have reported that they've had extreme hair loss. So these are all very important symptoms that we had not really kind of recognized. And so there's a whole new focus in research and support group out there to help individuals who have experienced sepsis kind of move into that recovery phase and supporting them through that process. Severe sepsis can also lead to organ function impacts. So individuals who've had sepsis that progress to septic shock, they may have long-standing complications that could affect their kidneys, their lung, or their heart, and that may lead to requiring long-term medical follow-up. Supportive care and importance. So individuals may need some supportive care when they're discharged home, such as physical therapy, some mental health counseling to help you deal with the emotional changes, the cognitive changes that you may have experienced from the development of sepsis. Specialized treatments and improved quality of life help assist in that recovery from sepsis. Sepsis Alliance is an organization that's out there that has taken on the challenge and the cause of the identifying of sepsis, educating our population about sepsis. They actually offer support groups. They offer generalized education for patients, for family members, for friends. It's a wonderful organization that I'm a member of. And they actually host which is called Sepsis Awareness Month, which happens to fall in my birthday month, so I never forget it, which is September. Yes, as for September, it's a great time to remember, where they host events and educational events and actual fund drives to kind of raise awareness about sepsis. And so I want to thank you for allowing me this opportunity to present to you and talk to you about sepsis. It truly is important to me in educating the community, because the early recognition and that education can lead to better outcomes for our population of individuals. So I will stop at this moment and I will take questions if there are any.
Thank you, Sister Les. Before we open it up, we do have one question that's pending in our chat, and it says, do you need multiple symptoms to suspect sepsis, or should you investigate if you have just one of the symptoms?
I would investigate if you have one of those symptoms, especially if you have any type of chronic diseases, diabetes, heart disease, lung disease, or if you're going through treatments for cancer treatment, or if you've survived those treatments and your system is still at a decreased immunoresponse. I would act upon those. You don't need multiple, if you have a fever, you should be calling your physician to find out why you have a fever. I hope that answers the question.
I want to add one thing before the question. I'm sorry. I just want to add something. I know someone has a question, and this is Reverend Flowers. Before I have to go, I have another engagement, and Minister Deborah Johnson will be taking over presiding in my stead. Minister Johnson is the chairperson of our faith-based coalition of churches, consortium of churches, and she's the chairperson. But anyway, I just wanted to put this point out to everyone, because these types of sessions are extremely important, and we need to have more of them, and we need to have more people. We need to really encourage people to sign up for these classes. And one of the main reasons I say that is because as Miss Johnson was speaking, the Lord put in my spirit that we need this, because when we go to the doctors most of the time do not have time to sit down and thoroughly explain to us everything that we need to know about certain things. But these sessions are geared toward us educating ourselves and others so that we can be more equipped to know how to handle the things that happen to us or our loved ones. And also just give us that needed knowledge so that we'll know how to proceed, what to look out for, and possibly aid in our own cure or the cure or healing of our loved ones. So we're going to be doing more of these. I'm going to turn it back over to Leslie for questions and answers. And then after that, Minister Johnson will take over. And I would like for Minister Johnson to also put a little plug in for our consortium and tell what it is. And churches are welcome to join. So back to you, um, Sister Johnson. The floor is now open for questions.
And maybe I've done such a great job at presenting, I've answered your questions, but I can share some personal experiences from my own family because I've had family members who actually experienced sepsis. And it seemed they thought it was just a small, minor issue that they were dealing with. I actually almost lost my father. He developed what seemed like a very small pimple. He kept saying it was just a pimple on my belly. And he did have some chronic conditions. He had cardiovascular disease. He's pre-diabetic. So he had those conditions, but he didn't reach out to me until later, where my mother called me and she was like, "Oh my goodness, Leslie, he can't walk. What he says his stomach hurts." And I'm like, "Oh my goodness, get him to an emergency room." And so by the time I got to the emergency room, he showed me this, what he thought was just a small pimple that he was trying to treat for himself at home. It blossomed into an infection that spread throughout his belly. So he had to have emergency surgery. He was in the hospital for about 3 to 4 days. We caught him at the early signs of sepsis. Had he waited, which I'm sorry to say most men do, if he waited one more day, it probably would have been a different outcome for him. I'm glad to say he survived that. We were able to get him home, but it was life-changing. He went home with about an 8-inch incision wound. So now he has to go home with a wound that we have to take care of. And prevent infection from that and treat that. But it was that recognition on my mom's part, but unfortunately it was on a kind of moving towards the later stages of sepsis. So just those, if you think it seems small, I don't want to waste anyone's time with that. Remember that sepsis acronym, that shivering, that extreme pain, pale color, they are confused, new onset confusion or sleepiness. Um, please act on those because that's going to result in a better outcome for you when we see you in the earlier stages. Unfortunately, what we see in the healthcare system is these individuals are arriving at a late stage and then prolonged hospitalization, unfortunately, prolonged post-recovery. So you're dealing with those recovery issues when you're discharged, or it can also lead to worsen outcomes for your organ system, such as your kidney, your heart, your lungs. And then the unfortunate outcome is non-survivability. So this early recognition, please act on it. Don't feel like you're wasting anyone's time.
Thank you so much. You know what? I have a few more minutes before I have to leave, but I do want to
Oh,
say
sure.
this. I'm sorry. I do want to say this. When you spoke of your father and, the lack of people paying attention to what's really going on with their bodies. And a lot of men are guilty of this, but so are a lot of women, my daughter being one. But back many years ago, my husband had this raspy kind of cough. And we were getting ready for work one morning. And I told him, I said, you need to go get that checked. His reply was, "Oh, there's nothing wrong with me." And this is like April of that year, April 2013. And I heard it again. I said, "No, no, no, no. I don't like the sound of that. You have to go to the doctor. I will make the appointment for you. If you don't want to take the time to do it, I will take off work and go with you. I will do this. I will do that." He's like, "Stop being so paranoid. There's nothing wrong with me." Lo and behold, that August, he got extremely ill. He got to the point where he couldn't even walk up and down stairs. He had to be rushed to the emergency room. That was on a Sunday. On a Tuesday, well, they got him to the hospital, diagnosed him with double pneumonia. On that Tuesday, they did a CAT scan and realized that he had lung cancer. The cancer had spread to both lungs. It was small cell lung cancer, which small cell lung cancer, I found out, is the most aggressive type of lung cancer that there is. I don't know if my husband, well, backing up. So that Tuesday and then that Thursday, they did the biopsy and realized it was spreading. Um, Went to an oncologist the following week, and they did a whole array of other tests and realized that the cancer had spread to his bones, his this, his that. It was all over his body. Within a month and a half, my husband was dead. I don't know if he had listened and gone to the doctor, if they would be able to catch everything in time, but at least we would have known and possibly could have prolonged his life a little bit longer. So I say that to encourage everyone, men and women, don't think that don't think it's not cool when you have some kind of symptom and not go get it checked. Prevention is the best medicine. And I encourage each and every one of you to pay attention to your body, pay attention to the body of your children, your spouse, your significant other, whatever. Encourage everyone, go get it checked. Go get it checked because you never know. So anyway, are there any other questions? Minister Johnson, you want to just go ahead and do like I asked you to do
Well,
earlier? I
I have a
kept.
couple. I have a couple of questions.
This is Minister
I got
Jessica
questions.
Johnson.
Go right ahead.
Okay, so I'm a MedStar patient, so I've sat in the doctor's office and while I'm waiting for it to be treated, and I've seen the videos that you guys have scrolling across on sepsis. And I honestly really thought up until you started talking that sepsis is something that might develop while I'm in the hospital getting treatment. And it doesn't mean that it isn't, but I didn't think about it in terms of the way you just described it. So my first question has to do with, and I did put this in the chat. If you have, do you investigate if you just have one of the symptoms, or should you have multiple symptoms before you say this could be that?
So, if are you talking in terms of if you're in the hospital or if you're
No,
outside?
no, like you said, your father had, like,
Uh-huh.
yeah. So,
So
but I mean, if you just feel like tired and fatigued, or if you feel chilled, are you checking maybe sepsis then, or do you need a multiple symptoms to think that this may be that?
I don't think you need multiple symptoms. If you wait until you have multiple symptoms, then you may be pushing yourself into that septic shock stage. So if you have a new tiredness that you've never experienced before, you should act on that. If you have a new shortness of breath that you've never experienced before, you should act on that. Don't wait for several symptoms. If it's something new that you've never experienced, that's the time to reach out to a healthcare provider.
Okay.
I hope
Anyone
that
else?
answers your question.
Yeah, that did answer my question.
Mhm.
I don't want to hog the questions if someone else has a question before I ask another one.
Well, no one else is coming up, so you can go ahead.
Yeah, I was gonna say I don't see anything in the chat, so go right ahead.
I don't see anything in the chat.
And,
Okay.
of course, if anyone else does have any questions, just unmute yourself. Go ahead, Minister
Sure.
Johnson.
Okay, so then my second question has to be with, and this is a bit a TMI, so give me, but because of some other issues that I have, I actually ended up having back to back UTI. Like I got a UTI, and then they gave me the medicine. Took them a while to get, and then a week later, it's like I was sick again.
Mm.
And I take Jardiance. Well, I don't take Jardiance anymore because that's one possible side effect of taking Jardiance and not doing everything possible you can to prevent the UTI. And now I'm wondering, like, I mean, should I don't know what I'm wondering, but I mean, I stopped taking that medicine, but should I be having more discussions with my medical professional so that I don't have to sit around worrying about sepsis? Because I don't want to worry about anything.
Absolutely. You should, if there's anything that's of concern for you or pressing or that you want more information on, I definitely encourage individuals to have those discussions with their providers. Um, I'll admit it is a challenge sometimes when we go into our providers, myself included, when they're limited on their time and scope and what they have the opportunity to sit down and discuss with you. But I press her. And she knows every time I'm coming, oh my God, this lady's coming with the list of questions and she's going to press me. But absolutely, we should be having those discussions with our providers.
So,
And not that you should worry about catching sepsis. I think education is key. So if you know how sepsis can develop, then you can work on those preventative things. So making sure you're up to date with your immunizations, making sure you're engaging in good hand washing, making sure that you're lowering your risk for being out in the community, around individuals that are maybe sick or individuals that may have not up to date on their immunizations, um, just knowing what you can do to prevent should arm you to help you feel that you're working towards the prevention of sepsis.
okay. Okay. The other thing that Reverend Flowers asked me to do. So I am Deborah Johnson, Minister Deborah Johnson. I lead what's called the Faith-Based Cancer Education Consortium. We do this in cooperation with Hope Connections. Our goal is to connect churches to make, because we have an opportunity through our ministry networks to reach a large number of people to share information on cancer, cancer resources, cancer support, events like this, our monthly Zoom. As a group of people, as a group of leaders, we meet every other month. But one of the things that we are very keen on doing, not only just working closely with Hope Connection, is making sure we share, that we support each other's cancer and health ministries within their churches to make sure that we share information. If you are a church who is interested, you may contact us through Hope Connections for cancer support, and or if through your individual churches or someone you know on the call. We'll be happy to talk to you, to invite you in our group, and to include you in our network of sharing information.
Thank you, Minister Johnson. As of now, we have what, 8 churches? How many churches do we have?
Since I'm working on 3 right now, I'm counting all 11 of them.
Oh, okay.
Yes.
So we have those churches already on board, and we would love to have other churches too involved. And each individual church has their own president of their cancer committee. I'm president of the Cancer Awareness Committee of the church that I attend, Central Baptist Church of Kent Springs. And I really need to really bring us back up to par, because a lot of things went on with me the past year that I kind of dropped the ball on a few things, but we are revamping. We're getting back to where we need to be, and to God be the glory for that. And I want to go back when I was talking about my husband when he did go into the hospital for the last time. It was like a month and a half after his original diagnosis. He had sepsis all throughout his body, and his organs just started shutting down one by one. His blood pressure started dropping extremely low. Everything in his body just started doing the opposite of what it should have been. because I was standing right there as they were working on him. And it was something that I had never experienced before, but it opened my eyes to a lot of things. That for me, not to just be proactive about myself, but to be proactive about my family, even though you can't make grown people do what they should do. But you can at least encourage them and maybe even give them examples of what's going on. But it's going to be in their mindset what they want to do. I don't know if my husband was just afraid to go to doctors, um, but I think that the more we educate ourselves on things, the better we are, and the better we can help someone else. Um, so at this time, does anyone have any other questions before we turn it back over to Hope Connection and close out? Okay.
I have a question.
Yes. And also announce who you are.
This is Fran McGuire.
Okay.
And my question is, if you want to get involved as a group, not a church, how do you go about that? And the reason I asked that question is that our family had a group, a cancer support group that my niece organized uh, because she had triple negative breast cancer, and she did pass. And after she passed, we as a family couldn't continue the group right away. It was just too much for us. But her sister, my other niece, she wants to revamp the group, and we need information. We need like some type of lifeline that can help us with information that we need to share. So with Hope Connection or the church that Minister Johnson is involved in and you're involved in, do you have to be church connect? Do you have to be a church? That's my question to get involved or get connected.
No, we will be happy to work with you.
Okay. Okay. Well, I will speak with Sister Fowler.
Yeah, Sister Fran is a member of Central Baptist Church, and she's one of our committee members. So I will certainly get her in touch with you, Minister Johnson.
Okay.
Regarding her family group, which will be separate from what I do at Central. So,
Okay.
Sister Fran, I will certainly aid and assist you in getting to Minister Johnson. And thank you so much for bringing that up. Anyone?
Thank you.
Just remind me, okay?
I'm sorry, this is Toya Williams, Sister Toya Williams from Central Baptist Church of Camp Springs. What piqued my interest to join today was that my father died from septic shock. And so but that was because he was in and out of the hospital and nursing homes and or rehab facilities. And he developed a bad sore that would never heal. And so I wanted to listen in to, for other family members that I may encounter that may be hospitalized or go through treatment or may have symptoms of a septic shock. So I wanted to just educate myself more.
Sister Toya?
Yes.
Hi, you remember Central?
Yes.
Please reach out to me, okay? Because I might be able to really help navigate you through things. We have a lot of we're trying to get people really connected and to reach out to your individual church ministry first and foremost. And I will certainly, keep you abreast of everything, all of the programs we're going to be presenting, and really, really appreciate your interest. So reach out to me, okay? Thank you.
Actually, you mentioned just as you were, I was listening to your stories, and it really touches my heart, and I'm really, it saddens me that unfortunately what brings us here is the fact that we've experienced a loss, just so that we can better have better understanding about sepsis. What I also want to empower you to do is, like, as a cancer as an individual going through cancer treatment or a survivor, if you do find yourself in a situation where you're hospitalized, please be your advocate and speak up. If you have ports or lines that are being initiated, or just general hygiene of people, hold them accountable. Because sometimes it's hard to hold us. We may be the potential source. A lot of people think coming into the hospital is a clean environment, but it's actually one of the most infectious environments. And someone mentioned it, I don't know who it was. You can develop sepsis in the hospital. You can come in for something else and you may develop sepsis. So if you're noticing people are not washing their hands, they're not changing their gloves, or if request it, hold us accountable and point it out to us, because the last thing we want to do is cause injury to individuals. If you have these devices that are being accessed, please make sure that the staff is adhering to strict sterile techniques when accessing them, because these are your direct lifeline. So if an infection gets in there, it goes directly into your system. So I just wanted to highlight that as I was just listening to, the sad story of the individual with the bed sore, just we are pressed for time in the healthcare environment, and sometimes we just we need things pointed out to say, hey, can you make sure you're doing XYZ, and stop people in their tracks to get them to adhere to best practices so that we're not inducing harm to the patient.
And also, thank you so much, Leslie. We so much appreciate you. And we can't say enough about being your own advocate. Be your own advocate. We also have on the line Sister Tasha Jones, who is the co-chair of the Cancer and Wellness Ministry at St. Stephen Church, but also the chair of Mercy House. First of all, she's asking in the chat if we can have a worksheet to list the preventions and other measures. But Tasha, I would be remiss if I didn't give you an opportunity to at least say something.
Minister Johnson, thank you. I'm sorry I'm not on camera. I'm actually at Mercy House right now. We are open today. It's the third Saturday, so we're here. So we're in the community giving out, clothing, food, appliances, stuff like that. So I'm actually here. So I'm not on camera, but I did participate. I was St. Stephen's Baptist Church, as she mentioned. It's a pleasure. It's a pleasure. I've been with Hope Connection for Cancer Support since I've been in remission for about 10 years now. So I love them. Love them, love them, love them. But thank you, and I look forward to other workshops. Thank you so much.